Have you ever stopped to think about how your body just works? It's like it's on autopilot, right? Well, in this explainer, we're going to peel back the cover on that autopilot system. We'll see how it works, and even better, how we can use some pretty smart drugs to hack it for some powerful medical results. I mean, seriously, you're not sitting there telling your heart, okay, beat. Now beat again. Or telling your pupils to get smaller in bright light. So who or what is running the show behind the scenes? Well, the answer is one of the most elegant and, you guessed it, hackable systems in the entire human body. It's called the Autonomic Nervous System, or the ANS for short. This is the master controller for pretty much everything you don't consciously think about. This whole autopilot idea, that's the key. Hang on to that analogy because it's going to make everything else fall into place. So here's our flight plan. First, we'll get to know the autopilot system. Then, we'll meet the two pilots who are always vying for control. We'll decode the chemical language they use to talk to each other. And then, we get to the fun part, seeing how we use drugs to hack that language to save lives.
Okay, first things first. To really get this, you have to understand that this autopilot isn't just one simple program. Nope. It's this incredible, dynamic balance between two forces that are constantly pushing and pulling, negotiating for control of your body.
So let's meet the two pilots in the cockpit. On one side, you've got this sympathetic system. This is your fight-or-flight response. Think of this pilot as the one who slams on the gas pedal in an emergency. It's all about spending energy right now. Then on the other side, you've got the parasympathetic system. This is your chill, rest, and digest pilot. This is the brake pedal, focused on saving energy and, just taking care of business. Your body's health really just depends on this constant, delicate dance between these two.
So how do these pilots actually send their commands to the rest of the body? They're not using radios. They use a very specific chemical language made up of things called neurotransmitters. To really understand this, let's switch gears and bring in our mechanism expert to take a look under the hood.
This language basically has two main words. The first one is acetylcholine. We'll just call it ACH. This is the main message for the rest and digest system. It's the signal to just calm down. The other word is noradrenaline, or NE. This is the main messenger for the fight-or-flight system. It's the signal to gear up for action. Pretty simple, right? A rest signal and a fight signal. But the real magic is in where these signals land. Now, check out this table. The fight signal, noradrenaline, has to dock at these specific landing pads, or receptors, to give its orders. Now, for what we're talking about today, I want you to focus on two really critical ones. See the beta-1 receptors? They're mostly on the heart, and they crank up its rate and force. Then look at the beta-2 receptors. They're on the lungs, and they relax the airways to let more air in. This difference, beta-1 on the heart, beta-2 on the lungs, is absolutely crucial. Trust me, we're going to come back to this in a big way. So if we want to hack this whole system, we've actually got a bunch of options. We can jump in at any point in a neurotransmitter's life. We can mess with how it's made, that's synthesis, all the way to how it gets cleaned up and removed, which is termination. This is a really powerful idea because it gives drug designers 5 completely different ways to target the system. It's how we get such a huge range of medical effects. And that brings us to the drugs themselves. Now, don't think of these as sledgehammers. Think of them more like molecular keys and superglue. Super precise tools that are designed to manipulate the body's autopilot with incredible specificity. Okay, at the most basic level, these hacks work in 2 ways. You've got agonists and antagonists. An agonist mimics the natural signal. It's like a perfect counterfeit key that fits in the lock and opens the door. An antagonist, on the other hand, blocks the signal. It's a key that fits in the lock but then breaks off, jamming it so the real key can't get in. So you've got mimic versus block. It's a really simple but powerful idea.
All right, that's enough theory. Let's make this real. It's time to step into the virtual clinic with our clinical coach and see how all this plays out when a patient's life is on the line.
Here's our first case. A farm worker is rushed in. He's been exposed to something called an organophosphate pesticide. Now, what these things do is they stop the breakdown of acetylcholine. So his rest and digest system is basically stuck on full blast. We call this cholinergic overdrive. So, what do?
And this is a real medical emergency. I mean, look at these symptoms. His airways are squeezing shut, he can't breathe, his heart rate has slowed down to a crawl, his body is essentially shutting down because that rest signal is just screaming everywhere with nothing to stop it. The goal here is crystal clear. The signal is stuck on, so we can't turn it off. But we can stop anyone from hearing it.
We need a blocker. We need an antagonist that can get to those acetylcholine receptors and jam them up fast. And that antidote is a drug called atropine. This is our go-to prototype antimuscarinic drug. It circulates all through the body and systematically blocks those ACH receptors. It's like it puts little earplugs on all the organs so they can't hear the poison's constant rest command anymore. And just like that, the heart rate comes back up, the airways open, and the patient can breathe again. It's a true lifesaver.
Okay, next case. A patient is having a massive allergic reaction, anaphylaxis. Their blood vessels have opened up so wide that their blood pressure is just crashing, and their throat and airways are swelling shut. We need a huge fight-or-flight signal, and we need it like yesterday.
The solution? Adrenaline. You might also know it as epinephrine. This stuff is the ultimate sympathomimetic. It mimics a full-blown sympathetic response because it is the body's natural fight-or-flight hormone. It hits the alpha-1 receptors to squeeze blood vessels and get that blood pressure back up. It hits beta-1 to get the heart pumping strong. And so critically, it hits those beta-2 receptors to open up the airways. One drug, multiple life-saving moves. Amazing. All right, last case file for today. Let's look at a drug that teaches us a hugely important lesson: selectivity. Let's meet propranolol. It was one of the first really successful drugs called a beta blocker. We use propranolol for things like high blood pressure or even to stop the physical symptoms of anxiety, that racing heart you get when you're nervous. It does that by blocking beta receptors on the heart. But notice that term on the slide, non-selective. Why is that one little detail one of the most critical safety warnings a doctor needs to know about this drug? Well, here's the problem, and you can see it right here in the table. Because propranolol is non-selective, it blocks both beta-1 and beta-2 receptors. Blocking beta-1 on the heart, that's what we want. It lowers the heart rate, lowers blood pressure. That's the good part. But it also blocks beta-2 receptors on the lungs. And what does that do? It causes the airways to tighten up, bronchoconstriction. For most of us, that's no big deal. But for one group of patients, it is a very big deal. And this right here, this is the absolute high-yield, gotta-know rule. Because it causes bronchoconstriction, you never, and I mean never, give a non-selective beta blocker like propranolol to a patient with asthma. You could literally trigger a massive, life-threatening asthma attack. This is the classic example of why understanding a drug's selectivity isn't just a fun fact, it's a matter of life and death.
So let's wrap this up. What are the big takeaways? Well, we learned that your body's autopilot, the ANS, is this constant battle between two pilots, fight or flight versus rest and digest. They talk using a chemical language, and drugs are basically just these really clever hacks that can either mimic or block their signals. And most importantly, we saw that knowing exactly what a drug does, its selectivity, like knowing propranolol hits both the heart and the lungs, is absolutely essential to using these powerful tools safely. Which leaves us with a final question for you. Now that you know the basic rules of the game, how would you design a better drug? If propranolol is too dangerous for a patient with asthma, how could you invent a new drug that still calms a racing heart but doesn't even touch the lungs? That's the kind of thinking that drives the next generation of medicine. Thanks for joining us.